Welcome. I'm Dick Deming. I'm Medical Director of MercyOne Cancer Center and the founder of Above and Beyond Cancer. Welcome to our weekly cancer education series. It's brought to you in part by a grant from the Rosalie and Sherry Exline Ziegler Fund. And tonight we're going to talk about physical activity and obesity. And my guest tonight is Dr. Lucas Carr. Hi, Lucas.
Hi, thanks for having me.
And Lucas and I are fellow South Dakotans, so we haven't gone into it, but I think that in South Dakota, there's only 1 degree of separation, and we probably would find somebody we know in common.
That's probably true. Yeah, there's not too many of us out in South Dakota.
Yeah, but if you come from South Dakota, you identify yourself as either someone from the East River or West River, because the
Oh,
Missouri River sort of bisects the state, and we're on the opposite sides of the river. So I grew up in East River, and Lucas grew up in West River
that's
in
right.
Lead, South Dakota, and then headed farther west to Laramie, Wyoming, where he got his bachelor's degree and also his PhD in really physical activity, exercise physiology sort of stuff, and then did a postdoc at Brown University where he really delved into behavior modification. And now he's an associate professor at the University of Iowa and does a lot of work in both physical activity, obesity, and behavior modification.
That's right.
So how does a kid from West River, South Dakota end up with a PhD teaching at the University of Iowa?
That's a really good question, and I I wish I had a real clear answer for you, but
Did you grow
it
up on a ranch or were you a town kid?
well, I was a town kid, so where I grew up was in the Black Hills in South Dakota. So there weren't many ranches there. Definitely a small town. I would consider it a pretty rural area. The town I grew up in was like 1,500 people, so pretty small, but not a ranching community. What it was, if you've ever been to the Black Hills, it's an amazing place, and there's a lot of just natural recreation opportunities. So I grew up skiing in the winter, and in the summer doing a lot of hiking and just playing pretty much any kind of sport that I could get into. Smaller towns, sports are kind of the things that occupy most of your time. So it was just a really it was an easy, fun way to grow up, and I think I just kind of developed this natural appreciation for both for being physically active and then also just being outside. It's
Mhm.
just a really great place to be. So
Yeah, and when you can do both, I would agree with you. I realized a long time ago that 2 things that bring me joy are being outdoors and engaging in vigorous physical activity, and to be able to do both at once.
yeah,
So did you ski at Terry Peak? Was that
that's right.
your home
Yeah,
base? Yeah.
that was my
Eh,
home base.
okay, so I can't help but comment. You've got some heads on your wall. None of those look like jackalope though.
No, no,
So if you've
no.
never shot a jackalope, correct?
That's correct. I never grew up hunting at all. Period. These are fake heads. So they're
Okay.
purely aesthetic.
Okay. Good. So, well, we could talk about South Dakota all day, but we're going to talk about kind of the relationship between physical activity and obesity. So I'd like to talk about that. And then in the context, we can talk a bit about it in relationship to cancer. But as you know, many individuals, and let me just give you a statistic that is just heartbreaking, that that 80% of women with early stage breast cancer, they go through breast cancer, and as you know, oftentimes early stage breast cancer will be a woman who has no symptoms and it's found on a screening mammogram, and let's say they're not quite at menopause, and we put them on this conveyor belt going through the breast cancer treatment factory, if you will, and they begin like totally healthy, and we send them through this treatment of surgery and radiation and hormone therapy and chemotherapy, and they come out the other end kind of being slammed into menopause early and having been told along the way, maybe you better take it easy and not exercise too much and take naps and eat bonbons. And the next thing you know, they come out the other end cured of their cancer, but having gained 20 pounds and changed their metabolism and sort of gotten into some bad habits. So that's something that a lot of patients that I have the opportunity to work with just feel so just so dissatisfied and want to then say, okay, I need to make some changes. So, do you experience? Have you had the opportunity to work with that sort of patient, and what's some of your observations about how, how to how to approach getting back to a healthy life after an experience like that?
Yeah. So one of the projects I'm leading right now is a intervention called Vitalis, and it's a lifestyle behavior change program for cancer survivors. The program is currently open. It's basically available to any cancer survivor in the young and middle aged categories, so 18 to 64 years, and we're recruiting people who have overcome cancer within the last 5 years, and all types. And really the meat and potatoes of the intervention is it's a health coaching intervention. And our health coaches, I think one of the unique things about our program is that our health coaches are students in our program who are training to become professional health coaches. They've taken a number of courses and have a lot of really great knowledge and understanding about physical activity and nutrition and obesity, and they just are looking for opportunities to apply that knowledge, and this is one of the opportunities that we provide them. Um, in that program, the person that you're describing is one of the many types of individuals that we work with, and that's a story that we definitely hear. People really struggling. They have this recent weight gain and struggling to get that weight down, and it goes beyond cancer survivors. Certainly that's a very common story for many people, certainly in the United States. Um, and you know it is really a challenge. The strategy that we have taken through our health coaching model is essentially, your health coaching for those who don't know, is a more of a bi-directional relationship between the patient and the health coach, that is really focused on the individual. It is focused on helping that person identify their own personal goals and helping them, stay accountable towards meeting those goals. Um, and one thing I really like about this is that it's a very non-judgmental type of relationship, such that the coach is just there to help brainstorm, come up with some ideas, some goals, set up some action plans, help that person consider the challenges that are really preventing them from meeting their goals. And it's a lot of conversation, and ultimately, hopefully, it's the patient themselves that helps kind of drive what the solution is going to be, which is kind of a different model than what I think we used to do in these types of interventions that I've been involved in, at least in the past, where we would have kind of an expert model where the expert is telling you should go do this, this, and this. And what we know about those types of approaches is, if it's not, if that solution doesn't fit within the individual's lifestyle, or it's something that they just simply don't enjoy doing, it's going to be really challenging for that person to stick to that approach, whatever it is. um,
Yeah.
you know so that's the approach that we have taken. And so, yeah.
Yeah, I wanna dive a little deeper about behavior modification. So, as you know, about 45% of cancers in the United States are caused by modifiable risk factors, things that we can do. We can eat healthy, we can maintain a normal body weight, we can engage in vigorous physical activity, we can not smoke, we can drink less alcohol, we can get vaccinated, we can do all of those things. And many of us would get an A on the test of what we should do to accomplish those goals, but we don't always, even those of us who know exactly what to do, we often fall short when it comes to the practicum. So, if I understand right, a lot of your postdoc had to do with this behavior modification. So, what's the science on the best way to get individuals who already know what to do and want to do it? What's the best way for a health coach or a professional who knows the science of behavior modification to help someone achieve a goal that they understand and they want to accomplish?
Yeah, that's a really good question. And I think what you're getting at is, our good intentions or our best intentions don't always translate into real behavior change, despite our having high motivation. And the person you're describing, like the person who knows what to do, they're even motivated to do it. That is really the person that our group works with most exclusively, which is very different than the person who is potentially being referred to us by their healthcare provider. The provider said, based on these health tests, I think it would be a good idea for you to talk to this person. We have really found that it's quite challenging if the person is not ready to make a change. It is quite difficult to embark on that journey. But for the person who is ready to make a change, a lot of my work, I've kind of because of that, I've kind of adopted or shifted towards. There's a theory called the multi-process action control theory, and what I really like about it is it recognizes this idea that good intentions don't always translate to behavior change, and that we need to treat individuals differently based on their strengths and their weaknesses. So there are some strategies that line up really well with helping a person build those intentions. For the person who's not super motivated, there are some things we can do to help them build those intentions. And some of that's about, kind of focusing on the motivation of the behavior. But when a person actually does decide, hey, this is something that I want to do, I want to make these changes, that's a lot of the stuff that our health coaches work on. It's a lot of what we call behavioral skills regulation, helping people identify what their goals are, helping people consider what the major barriers are that are getting in the way of meeting those goals. And then once we understand what those barriers are, then it's a lot of just kind of problem solving. This, I wish I could say that this was, high level, like rocket science stuff, but we do this every day. We problem solve our challenges all the time to figure out what's the best solution to fix this issue for me. And I think when it comes to health behaviors, eating healthy and being active and doing these things, we kind of forget that we have a lot of those skills within us. And beyond that, I think I would really like people to think about these types of health behaviors as a practice, something that we are working towards at getting better over time. We People talk about going on a diet, and oftentimes there's kind of like a time period there that, like, I'll go on this diet for 10 weeks and I'll lose 20 pounds, and that's okay. Sometimes that does work for folks. For most people, it doesn't. And I think a lot of that is because we fail to consider that we're trying to craft this practice that we want to become an expert in how to eat healthy and become an expert in how to build activity into our daily life. And that, like anything else, takes time and it takes practice. And so
Right.
that's really the message. That practice piece is the part that we really focus on.
And we really want to habitualize it.
Right.
I mean, so most of us at some age, I don't know, 4 or 5, maybe younger, learn to brush our teeth. And for most of us, we maintain that good habit for our entire life. Um, we also learn, what we're supposed to eat and what's in the good column and bad column, but but obviously that's a more complex thing of developing that habit
Mhm.
of just putting the good column foods on your plate and in your mouth. Um, I, I'm disappointed but not surprised that you don't just have one quick gimmick because, if you had a pill, I'd pay a lot of money for that.
Sure.
But,
Sure.
and we could get talking about the pill that now, people wanna take that's gonna supposedly to help. But but when it comes down to the hard work of developing good habits, what are some of the scientifically proven ways to, I mean, is it having accountability? Is the coach really there to provide accountability? Or what are some of the reasons that a health coach works when a highly intelligent person who knows the right answer can't do it on their own?
Sure, that's a good question, and I'm glad you brought up the habit piece because this is another reason that I like this theory that I subscribe to. Once a person has decided that they are going to make this change, and then they've embarked upon these changes, and they're really practicing these probably new strategies for them. Those could be new strategies for improving their sleep. It could be for improving their activity or improving their eating patterns. Um, Once a person has figured out what it is they want to do, we encourage them to practice and to do that for a period of time. And if a person is able to practice, that can then lead to habit formation. Um, the science on habit formation has only really kind of come alive in the last, I would say, 10 or 15 years. And so we're definitely still learning about what are the best ways to develop habits. But we do know some things. um, it goes beyond just repeating something. Repeating something helps establish a habit, but what's really important is identifying the cue to the habit, and specifically contextual, what we call contextual cues. So you might think about if there's a habit that you currently do. it, I would ask probably, where does that habit happen, and at what time of day does that habit happen, and are those are those two cues consistent for that specific habit? You brought up the example of brushing our teeth. I would probably venture to guess that most people, when they brush their teeth at home, they're probably in the exact same location, and it's probably relatively close to about the same time of day when you do that. And whether we're thinking about it or not, that process has probably become very habitual. It's something, the definition of a habit is that it is very automatic. We do it without putting a lot of thought into it. And what we're finding now is that location piece and that timing piece are really important when we're creating new habits. I have a kind of a silly thing. I teach a class on behavior change, and we talk about habit formation. And I tell my students this, and I think they think I'm ridiculous, but this is true. I have a habit of whenever I brush my teeth at home, I do. I have a timer toothbrush. It goes for 3 minutes and then it stops. And during those 3 minutes, I do squats while I'm brushing my teeth. And I've done this for probably going on 5 years now because I was interested in trying to figure out if I could establish a new habit. And it has worked. Um, the interesting thing is, it only works if I'm at home in my bathroom. If I'm at a hotel room or something and brushing my teeth, or I'm at visiting some friends, I won't do it. And I think it's because there that contextual cue of like the location isn't there anymore. It doesn't naturally prompt me to engage in that behavior. So I think we're learning stuff about habit formation, but there's definitely um, a lot of room for improving our understanding, in the science.
Hmm. So the cues, as you pointed out, location, timing, and I've read some articles, and this may be that things that you do habitually in the morning tend to be more
Hmm.
stick with you better. Whether it's okay, I'm at the YMCA at 5 a.m. and my buddies are there, and if it's first thing. It's when I give myself the time, and that's easier to maintain than if you think, oh, at the end of the day when I'm done with work at a variable time that it's more difficult to sustain that habit.
Right. Yeah, there is new interesting research about, like specific for exercise. They're finding that people who exercise in the morning tend to stick to that habit longer than others. Um, and that could be that, those people are just maybe more naturally more conscientious. But there's also evidence. There's been a long running study called the National Weight Control Registry, where they have recruited people who have been successful weight loss maintainers. And their definition is, have you lost at least 30 pounds and kept it off for at least a year? And they ran a bunch of studies and just asked those individuals who they consider like successful weight loss, you know, weight maintenance folks, and they wanted to learn, well, what can we learn from these people who have been successful at making this change? And they find that the number one thing that predicts this successful weight loss maintenance is, doing a lot of exercise, certainly, but it's really the habitual nature of that exercise. These people are very regimented in both their exercise and eating breakfast every morning, and just keeping a pretty consistent schedule. And so it all lines up with, the keys to success are probably not just one thing. It's probably, finding the thing that works for you, sticking with it, and practicing it until it becomes a habit.
Well, let's talk a little bit about behavior modification as it relates to diet. So, as you already said, there's this idea of I'm going to go on a diet to lose weight. That is just, I'm going to reduce my calories, maybe very significantly, and I'm going to see the pounds shed off. And then I'm going to go off my diet and go back to whatever I do besides be on a diet. And obviously you've already pointed out that maybe a structural change in how you eat that you can stick with for a lifetime is better than dieting. But do you have some evidence-based ways that have been successful for people to modify the way they eat, that they stick with it? And do you think it's more the type of food versus the calorie counting versus portion control versus just walking out of a room that has a bowl of M&M peanuts sitting in it?
Sure. Yeah. I think this is the trouble with like exercise. I feel very comfortable in the world of physical activity and exercise because it seems like an easier thing to tackle. The world of nutrition and diet and eating, there's just so many variables
Mhm.
that are there that it can be overwhelming, I think.
Yeah, because
Um,
much of the physical activity, and not to interrupt, but, it's doing something, and I'm
right.
gonna do this every day, and from my own experience, maintaining weight is not doing something,
Sure.
and I got the best intentions, and then somebody's brought in a big bowl of homemade cookies that are still warm that I had no intention of having on my in my, um break room next to my office that I'm smelling. I mean, I did not intend that to happen when I started my day.
Yeah. Yeah, we there's a couple of things that I would say about that. One thing that we talk about is creating if-then strategies. Knowing, kind of predicting that some of these things could happen in your day. If this happens, if people are bringing snacks or treats into the office, then I am going to, and then you fill in the blank with what your strategy is. That's one thing we talk about. But in terms of helpful strategies for improving, eating patterns. You hit on an interesting point of the idea of whether you're going to add something to your day or if you're going to, totally restrict yourself from probably some things that you just genuinely enjoy eating. Um, a colleague of mine, Dr. Kathy Mellon, is a registered dietitian in our department. And her strategy, her recommendation is to simply, if you were going to focus on one thing, and you wanted to stick, be consistent with the national dietary guidelines, her recommendation would be to add fruits and vegetables to your diet and really focus on that one thing. And if you do that successfully, it's likely naturally going to result in a person replacing some other types of foods that are probably less healthy than those fruits and vegetables. And some people find that strategy just to be, it's simple, it's easy to remember. It's really about then figuring out, well, what are some easier or palatable ways for me to add fruits and vegetables to my diet. And so that is one way to go.
And when you are using your health coaches in this study, Vitalis, I think was the name, um, do you're exploring with the patient what will work for them in, who buys the groceries, who makes the food, what do you do for lunch? What are, again, some of the evidence-based methods of interacting that have shown the most promise?
Yeah. So the health coaching, it's kind of interesting. I would say that the science of health coaching is not really well developed, to be honest. I mean, there have been some systematic reviews on health coaching and the in lifestyle health coaching, but it because it's such a it's a communication style that is so applicable to many different areas, many different conditions, including cancer, diabetes. People are just interested in improving their wellness. There, from a scientific standpoint, there's a lot of variability introduced there. A lot of different strategies that health coaches can take, a lot of conditions that can be the targets of those interventions, and a lot of variability in what's measured to determine whether those approaches are effective. So I think there's a lot of room. I think it's a wide open field and a very
Mm,
important field because health coaching is something that is growing as an occupation. I think there are some changes coming down um, in the healthcare system in such that health coaching will be a reimbursable service, and so it'll be something that's more present in primary care. Um, but in terms of evidence-based strategies, we do know that some of these the way that I think about this and the way that I teach my students is to really consider what we call behavior change techniques. And there is a taxonomy of behavior change techniques that have all been shown to have some degree of evidence to support their effectiveness. And there some of these things are things we've already talked about. The idea of setting goals is a really important strategy behavior change technique that we know has an impact. If people have a clear, we talk about like SMART goals a lot, very specific, measurable, action oriented, realistic, time bound goal. That's really helpful for a person to know what they're striving towards, and a health coach can help a person identify a good SMART goal. Um, some of the other things I've talked about are like problem solving is a behavior change technique, and we definitely encourage our health coaches to engage in problem solving with individuals. Um, Self-monitoring. I have a monitor on my wrist right now. We use these Fitbits or whatever activity monitor you want to use. That's a behavior change technique that we also employ in our Vitalis program. We give everybody a Fitbit, and we encourage them to wear that every day, just simply to keep an eye on their current behaviors, like how active are you today, and how active were you last week, and what we're trying to see is a steady improvement in those behaviors. So we use a lot. We kind of rely on a lot of these behavior change techniques that have been shown to be effective, and introduce those into the health coaching process.
Um, I'm interested in learning more, maybe about the science of, so the client, if you will. So I've no basis for saying this other than 70 years of living, but I would think that the personality of the client factors in. So, I mean, do you ever do like an MMPI or inventory to
Mhm.
figure out the personality? Okay, so I'm somebody, I love to please somebody, I love to make them happy, so give me a coach that really, I want to lose weight, but I really want to make my coach happy. And so that I'm likely to succeed because I have this personality that wants to please people. Is there ever a process in coaching before you start the coaching to assess, okay, what's this person's, let's just say, personality, whatever phrase you use for, which box you put me in, and that you start the process maybe different depending on what you think the person's personality is, or do you just sort of learn that organically as you go along talking to someone?
Yeah, we've never done that, and I think we at least for our program, we just don't really have the luxury of doing that. You know, we're training students to be coaches, and so our goal is to ensure that these coaches are getting as much contact as they can with a variety of patients that come to our program. And so I wish we could. I think it's a great idea to do a little bit of matchmaking, I guess, on the front end to make sure that the personality of the coach aligns well with the personality of the client. I think that'd be really fantastic because there's all kinds of people that we you get along with and don't get along with. In general, though, our coaches are like this is the the procedure itself, the scope of practice for the coach is really to try and maintain a non-judgmental viewpoint, and really, they could have a person who, I think an example, we had a recent client whose goal was to do, you know, uh, just really focus on sit-ups, just a ton of crunches, and which is fine that that's what they want to do. The coach is not there to say this is not a good goal. There's to say, okay, well, let's think about that goal and maybe reconsider some other approaches, or maybe I can share some literature with you. So yeah.
But is there, from the science of behavior modification, is there theories on looking at the personality of the client and matching, that some respond to authority, some respond to, I don't know, um, treats, and trying to match the style with the personality. Is anybody done that?
Not to my knowledge. We the only work I've done in the area of personality, we actually did do a study looking at personality differences among people who are successful at losing weight.
Hmm.
And the one facet, not surprisingly probably, there are many facets of personality, and the one that most strongly predicts whether a person is able to lose weight and keep it off is the facet of conscientiousness. And you know people who are highly conscientious tend to follow the rules. They tend to be organized. They tend to be um, you know pretty strategic about keeping up with things. And so really that does line it up with the things that we do know about successful behavior change.
Let's shift gear just a little bit, and I'm interested in the science, but also your opinion about where we go with acceptance of body size, body shape. To what extent does the science say we have a set point and that's kind of where we're going to be, and we can do some things to get us off, but we end up back at the set point? At what point do we feel like we're shaming people? At what point do we, yeah, what's the right way in this day and age to, as a doctor taking care of a patient who has gained weight? I can talk about weight. I could talk about BMI. I know that there's some people who think that isn't the right language, that isn't the right thing to do. And I'm really kind of confused as to how to best help someone, and whether, mentioning the obvious, if someone is clearly 100 to 200 pounds overweight, what, in the context of seeing them as a cancer survivor, and okay, let's make sure your cancer's not back, but what's my role and how far do I go and what sort of language do I use, without being accused of fat shaming?
Sure. Yeah, this is an interesting topic. So when I came to the University of Iowa, I was actually hired as part of an obesity research education initiative. The university at that time was really kind of focusing on these cluster hires and really trying to focus on big societal issues. One of which they identified was the area of obesity. And so they hired, I think, 10 faculty members in different disciplines to come and focus on this topic. And kind of a like a bad matchmaking game is like, you all come here together and work together and fix this issue. It didn't quite quite work out that way, but um, my role, one of the things that I did when I got here was, as part of the education piece of that initiative, was to create a class on the topic of obesity, and I've been teaching that class in our department for the last 10 years. And um, prior to teaching that class, I don't think that I would have said that I was necessarily an obesity expert. But when you have to teach a class, you learn a whole lot about a topic. There's no faking it at that point. And one of the topics that has become one of my favorite lectures and topics of the semester is the issue of weight stigma and weight bias. And this was not something that I was super familiar with beforehand. Um, and actually, currently, I'm part of a research team where we're developing a kind of a brief training course on this same principle, this idea of weight bias and weight discrimination. And what do you do about all this? Because you're right, it's a complicated issue. I run into this in my class, like using the correct terminology. What is our role as healthcare promotion specialists and healthcare providers? Um, where do we point the finger? And what I think I have concluded from my work in this area is that certainly there is a whole lot of weight discrimination and a lot of weight shaming that goes around. It is a very, very prevalent issue, and there are a lot of real both health and social consequences that come from this. There are plenty of examples of people who are denied promotions, denied being hired for jobs. There's punishments that go along with both kids and adults. There are groups that are particularly prone to being discriminated against for their weight. And what I'm interested in, I think, is one of the big drivers of a lot of this discrimination is a fundamental misunderstanding of what the causes of obesity are. The prevailing thought by many people to this day is that this is strictly a willpower issue, a behavioral issue, and it is up to the individual to fix this issue. When really, if you look at the evidence, that is really not the case.
Yeah.
Obesity is something that it's a very multifactorial factorial
Yeah,
disease that has lots of
yeah, I agree, but
causes.
and this is, in the context of this conversation before we got on this topic, though, I think I heard you tell me that the people that are most successful at losing weight, you used words like conscientious, um, get things done, and you used all these positive language, leaving us to believe that those who aren't successful don't have those positive adjectives, and so even in the act of saying, what's how do people succeed, it was all these positive adjectives leaving us to believe that the inverse must be true.
Yeah, so I'm not a personality expert, um, and I don't play one. But what I do know about personality is that this is one of those things. It's a really good example of something that we are mostly born with. I think that the evidence suggests that personality does change over time with age. It's not clear whether personality is something that we can modify a whole lot with interventions. I think that's like a novel, interesting area of research that people are exploring. But by and large, people are born with a lot of the personality characteristics that we have. And if you're a person that's lucky enough to just naturally be a very conscientious person, you're probably going to be doing a lot of the things that are helpful for maintaining a healthy body weight. But not everybody is. And beyond, similar to that, if you're a person that was born into a family that is predisposed to gain weight in an environment that promotes weight gain, you're probably going to gain weight. If you have tall parents, you're probably going to be tall. If you have larger parents, you're probably going to be larger. And there's a lot of evidence that suggests that our genetics and our biology play a major role in whether an individual is normal weight, overweight, obese, and these are things that are largely out of an individual's control. The other part that is largely out of our control is the environment that we all live in. And there's really good evidence to show when people move to the United States from other countries, there's really interesting data showing that people gain a lot of weight because of this new, you could almost argue, a toxic food environment that they've been placed into. And again, if their biology predisposes them to weight gain when faced with that kind of environment, they're going to gain weight. Um, on the flip side, if you have somebody, my wife is an example of this, and she would murder me if she heard me saying this, but she is a person who could eat macaroni and cheese every single day and would if she had the opportunity to, and will not gain a pound. Her biology is incredible. Her metabolism is incredible. Something that she was just blessed with. There's nothing that she can do about it, but she will not gain weight despite the environment that you put her in. And if you step back and look at the obesity epidemic that we have, we've seen this progressive increase in the prevalence of overweight and obese individuals over time. And there are clear um, trends based on geography that line up with the food environment. There are major drivers of the obesity epidemic. I think this is the piece that people don't understand, and we tend to place all the blame on the person who is suffering from the disease, um, in a way that we don't for any other types of disease. We don't look at a cancer survivor and blame them for having had cancer. But for some reason, when it comes to obesity,
Mhm.
there's a lot of that that goes around, and I think it's because people don't understand the disease.
Yeah, good points. I would say that we still do blame smokers for their cancer.
Sure.
My mom died of lung cancer. She smoked. It was definitely something that, but then you could say, did you truly have control? Did you know what we know? But I do think we do still sometimes blame some people. We also, I think, as people learn more and more about the relationship between obesity and cancers, there's the potential for blame there. I'm not saying it's appropriate. I think I'm hearing you say that maybe there's like this epigenetics, and it scares me that as you see the obesity rate, the overweight weight go up and up and up, are we just creating the likelihood that it's going to continue because now we have perhaps something epigenetically happening that you pass on to your next generation, that increases their likelihood, and that it becomes increasingly more difficult to break the cycle. Um, is there thoughts about that, about the
Yeah,
epigenetic effect of?
I think there is evidence for that, certainly. The part that is a little concerning to me is that it doesn't quite appear that we have hit the peak. For a while there, every year when I teach my course, so, we go through the new annual prevalence rates for obesity, um, and every year it's gone up. There was a period of time there where it seemed like things were leveling off, but then COVID happened, and man, some of these prevalence rates really shot up. And so it doesn't quite appear like we have maxed out. Unfortunately, we have 75, 76% of U.S. adults in the overweight category. We have 35 to up to 40% of adults being diagnosed as obese, and the trends for children are also increasing. And so when I'm looking at you know the the major causes, like we definitely can and should talk about individual level strategies to help individuals take control of their weight, and there are definitely things that can be done. But if we really wanted to reverse this obesity epidemic, I think we have to take a really strong look at the major drivers of that epidemic, which are a lot of the foods and beverages that are and the ingredients within our foods and beverages that have permeated our food system. Um, there's sugar is everywhere. High fructose corn syrup and preservatives are everywhere, and those are things that, unless you're some sort of food detective, it can be really really difficult to sniff out like how much of that is in your standard yogurt that you find in the grocery store. You might think that you're eating something that is really healthy, but reality, there's a whole lot of stuff in there that um, is probably contributing to your weight gain.
I have one more question, then we're going to open up for questions from the audience. And this is not a realistic question, but I'll let you comment on it. So, diet, exercise related, both important. If one wants to make lifestyle changes to be healthier, what's easier to focus on? Which of those? And I realize it's both, but sort of order of priority. How do you think someone is going to be more successful if they put an emphasis on the diet or an emphasis on exercise?
Well, if the intended goal is to lose weight, I would put my money on changing diet. The weight is largely driven by energy intake. It is influenced by energy expenditure, but it is quite challenging to just purely exercise away the pounds. It takes a high volume of physical activity to do that. The example we talk about is the amount of effort it takes to burn 150 calories that you might get from a candy bar. That takes a lot of energy compared to not eating that 150 calorie candy bar.
If the
Um,
goal isn't how much you weigh, but how healthy you are,
yeah, different
how
question.
how good you feel, how much joy you have in your, let's just say how healthy you are.
Yeah.
Is there still the same formula?
Well, I would maybe change my answer if that's the goal, um, simply because there are so many benefits that come from physical activity. You could look at virtually every system of the body, and almost every system is improved if you are regularly physically active. And that's independent of whether you lose weight, gain weight,
Mhm.
um, for all ages, for all sizes. Um, Physical activity, like we talk about, exercise is medicine. There's a lot of truth to that statement.
Okay. Well, great. We're going to open up to questions. So, again, we have a live studio audience here we'll turn to first. And then, if you're watching us live streaming right now, please put your questions in the comments section. And we'll start with our studio audience. Angelita, you get to go
Oh,
first.
thank you. Yeah, my name is Angelina, and I'm a type 2 diabetic. So I had a lot of things going against me between my obesity and diabetes. And so the doctor, the diabetic specialist, was putting me on a Ozempic. And I go, I've heard of that before. And she goes, you probably heard about Hollywood personalities have been using that to lose weight. And she says, this will help take two things. And I went, wow. So, what is your opinion about using Ozempic? Not just for diabetics, but for people that to use that to lose weight.
Yeah,
Um,
um, it's a good question. Thank you for it. I have no judgment on this. There are some pretty good prescription medications that are available now. 10 years ago, I wouldn't have been able to say that, but today there's more. I think six, maybe seven different kinds of medications through prescription that are designed specifically for weight loss, and they work slightly differently. I know that this one is one that people have been really excited about, and it's simply because it's been shown to be pretty effective and pretty tolerable. And if that's the case, and it's something that a person has access to and can take, there's definitely the evidence is definitely supportive of a person losing significant amounts of weight and being able to keep it off. I will say, like any intervention, the effect is maintained as long as the intervention is in place. So if I were to take like a cholesterol lowering medication, my cholesterol will go down as long as I'm on that medication. So, these types of drugs are meant to be long-term strategies. I would probably, the recommendations are that with any type of weight loss strategy, behavior changes are recommended and should be accompanied by the medication. So it's still important to consider ways to improve eating patterns and be active on a regular basis.
Okay. Thanks.
Yeah, I have a question, about your programs that you have to, as you have your students be coaches on this. Is this something that is available to the public? And if so, how would you get onto it?
Yes, thank you. It is absolutely available to the public. Um, we have a flyer here that I think we can share with folks. Um, and there is you can see there's a QR code embedded in that flyer. If you use the camera on your phone and scan that code, it should automatically take you to a survey that you would complete. And if you do that, you will automatically be connected to our research team. Um, this is a program that is technically is run out of our lab in Iowa City, but it is available. It is completely remotely delivered. You don't have to travel to our lab to participate. We have people from Texas who participate, and so you would meet with a health coach if you were eligible. You would meet with a health coach by Zoom, and we would get you started in that way.
Lucas, eligibility criteria. That pamphlet at the top says young adult
Yeah,
cancer survivors. Have you changed that to include a larger demographic than just young adult?
Yeah, that's a good catch. We actually did just make this change because we were noticing there were, the young adult cancer survivor population is a pretty small group. But if you look down below, we did change the age range to 18 to 64 years, so we have include both young and middle-aged adults. But I will definitely make that change to the top as well.
Yeah. Okay, good. So that's good to know. And just to repeat for what you said, it's free of charge,
It is
correct?
free. Yep.
And it's done totally remotely, and you don't have to be referred by a physician. You can refer yourself. And so we'll make sure that way of accessing the program gets distributed. And also, Lucas, I've referred a patient went back when it was young adult. Now that I know that it's much broader, can probably help in recruiting. Is there a particular duration of time? So if you were to do it, you obviously can drop out. There's no, but you
Yep.
would be. The intent would be for you to stay with the program for how long?
The intervention runs for 8 weeks, and so the meetings with the health coaches are weekly at the beginning, and then they start to move to bi-weekly visits towards the end. Once a person is kind of established what their goals are, and they kind of know what they're working on, we kind of spread out the meetings with the coaches a little bit less frequently towards the end. So
And
8 weeks,
this is not just about weight loss, and
right?
it's not just about physical activity. What would you say are the top 5 things that you hope to improve in an individual's life if they participate?
Yeah. So our screening, if a person takes that survey, it'll ask you 3 questions one about your physical activity, one about whether you're eating, how many fruits and vegetables you're eating each day, and one question about your sleep. And if you report something that doesn't quite meet the recommended guidelines in any one of those 3 areas, then you would probably be eligible for the study. Um, when it comes down to it, the meeting with the health coach is really about figuring out what it is you want to do. So the first question a health coach is going to ask is, what is your health vision? What do you want to achieve here? And a person can decide whatever they want to do. It could be I want to improve my sleep if that's the thing that's bothering you. I want to be more active. I want to change my diet. And there's a lot of things you can change about your diet. Some people actually are interested in making changes to their finances and retirement plans. And that's something that coaches are, it's the same strategy. What do you want to do? Let's figure out some ways that you can achieve those goals.
Okay, thank you. Other questions?
So I'm always thinking about the media in particular, and I think the media is behind a lot of what's wrong with the country, and maybe some of what's right, but a lot of what's wrong is because of the media. And the media has convinced us that food is entertainment, that people should take pride in being a foodie, and of course they're inundating us with these food commercials, and so does media literacy play a role in this, in teaching people to understand that you're being affected overtly by the media and covertly, even if you don't think that you are? It's influencing us all, and it's got a lot to do with the obesity epidemic.
Yeah, that's a good question. The research, I can tell you that the science research answer to that is most of the research on that topic has really focused on kids, because you're right, especially kids under the age of 13 really do not understand the persuasive intent of commercials and marketing. And commercials and marketing are effective. McDonald's would not spend what they spend on their marketing if it didn't work. And so there's a lot of intentional nudging from media and marketing that has really contributed to people, how we view foods. Coca-Cola is a good example. It's you think about Coca-Cola, you'll probably have some sort of feeling that comes with that, and it might be something related to happiness, because that's a big that's part of their branding. Um, so there's definitely the idea of media literacy and understanding that the persuasive nature of these advertisements. I think you're right. There's a big role there.
Great. George, do we have any questions online? Because we're getting at the end of our hour here. Okay, Angelina, you get one more. Final question from Angelina. We're getting her the microphone here.
Is it on?
Okay, we got
Okay.
it on. Here
Yes. One more question. It was brought on by George on the media. Now you see all these products for selling food items like Jenny Craig and all these other industries. Are those good because they come prepackaged? You can lose the weight. Do you believe those are good assets or not?
Yeah, so I would view that it would kind of fall in the category of portion control strategies, and there's evidence, there's evidence that portion control can work if it works for you. Um, Pretty much any diet, if you look at the evidence, diets work, but they only work if people stick to the diet, or stick to whatever that strategy is, and it's that adherence part that's really important. So what I think is most important is figuring out what works for you. Whether there's evidence that supports the ketogenic diet is effective for weight loss, or a low fat diet is effective for weight loss. Some people really do not tolerate the ketogenic diet well at all, and it's just not going to work for them. So it is important for the individual to really do some exploring and figure out the strategy that works the best. And if the portion control strategy that Jenny Craig and some of these other products offer, just lines up, it's time efficient, it's easy to do, then there's no harm in that. Those can be effective strategies.
Great. Well, thank you, Lucas Carr. Lucas Carr is a PhD and associate professor in the Department of Health and Human Physiology at the University of Iowa. Thanks for sharing your wisdom and insight with us today.
Yeah, thank you so much for having me. I appreciate it.
Great. And thanks everybody for attending. If you know someone who would benefit by watching or listening to this show, it'll be available tomorrow on demand at the Above and Beyond Cancer YouTube channel. It will also be available at the MercyOne Cancer Center website. Thanks for joining us. Please join us again next week. Thanks.